Okay.
Our next. Hey guys, Dr. Dennis here. This is Emma. Emma has been a patient for quite a long time, and right now Emma is how many weeks pregnant?
24.
24 weeks pregnant. So she's been coming in pretty consistently over the years for wellness, and now through the pregnancy, she is coming in a little bit more often because through pregnancy the ligaments change, there's hormones being produced, and they make our body a little less stable, a little bit more loosey-goosey. That sounds like a good thing, but it can allow for things to not stay in place very well. She brought with her beautiful daughters, and they like to sit right here in the little window. You want to say hi?
You wave?
The cats got their tongue. We saw a little squirrel out there earlier, but I wanted to take this moment to just kind of videotape a pregnancy adjustment. I'm going to work a little bit more on the ligaments in the front of the pelvis called the round ligaments, because that can become really a sore spot when our tummy starts to grow, and it has these ligaments have to hold a little bit more weight. And then Cindy, if you could also get a look or a shot of the table, it's going to be a little bit more accommodating as I do a little bit to allow for a tummy to just have a little bit more space. So if you want to stand up, we just raise the table up a little bit, and then this section down in the middle actually lowers down, and we put a little pillow there. And this is one of the things that pregnant moms love the most, because they can actually lay down on their tummy. Okay, does that feel pretty good?
It does feel good.
Be able to lay down on our tummy and just chill out and relax a little bit. So climb aboard. I'm going to have you rest your face right into cradle there. So it begins the same as any other adjustment. What we're trying to do is to improve mechanically any areas that might be not moving very well. The sacroiliac joints right in through here. There's a lot more stress and strain on these lower muscles in the lumbar spine. So we want to do a little bit of a massage to just get things relaxed and ready for an adjustment. We don't like to just jump right into an adjustment. We like to do some muscle work prior to the adjustment. Now, I also use a machine that we call the thumper that is used to help relax the muscles. Emma, do you usually like that thumper quite a bit?
I do, yeah, it feels really good.
Fantastic. So, put a little cushion on her back. And girls, you're doing super good. High five. Yes. High five. Go. How about up here? There, thank you. All right, so the thumper is the high-speed massage, and it does feel really, really good. Originally, Emma came to us and she was having a lot of shoulder problems, so I'm working the shoulders a little bit more on the top. And through injury, we have scar tissue that can form, and scar tissue does end up being a place of higher sensitivity. It can be a cause of discomfort or pain. We want to work that scar tissue out and bring blood flow into it. Is that feeling okay?
Yep.
Fantastic. You can just stop now, see, and then now we're going to start adjusting Emma's spine. We're going to start down here at the sacroiliac joints, and as I mentioned, these joints here can become stuck. And there's a lot of stress down here in the muscles that support our lower spine, and if they get tight, it can pull things out of position. So we're going to look at improving mobility. Now, all of this is very, very safe. In fact, it's more than safe, it's very healthy for both the mom and the growing baby, because if the mom's happy, the baby's going to be happy. So we're going to do some light drops, and this is really noisy. And I have my helper here. Are you ready? Good. You are such a good helper. Good. Now I want you to take a deep breath in for me and let it all the way out. Good. One more. That a girl. How are we feeling?
Good, yeah.
Very good. So now we're going to turn you onto your side. And of course we have to make some accommodations to the table or changes. So we'll do that. And we'll end up on our side. Good. And then I'm going to just bump this up a little bit. Now we have another helper, which you can never have too much help, right guys? That's for sure. All right, we're gonna take a nice deep breath in, and we're gonna squeeze and turn. Nice. Very good. Now let's turn all the way to the other side.
Okay.
What's this guy's name?
She is a girl.
She's a girl.
She's a girl. What's her name? She's pretty.
Flamingo.
Flamingo. Do they stand on one leg?
Yes.
Outstanding. That was really good. Now, as you'd imagine, if we're carrying more weight as we're pregnant, there's a lot of stress on the ankles. We're going to make sure we take a little bit of that stress off the ankles. Just a real quick impulse. Very good. Nice release. Very nice. And now, just for a postural, we want her to stand up tall. The weight is, tends to pull us forward and take us out of our posture. So we want to stand up nice and tall. I want you to take a deep breath in and relax. Good. Far enough. Now you can rest your hand right on your tummy. The flamingo adjustment is the best one, isn't it? Good. Nice. No, that was a good release too. Just right here.
Mommy.
Feeling a little pressure right off that spot.
Flamingo.
Flamingo.
Nice. Right there. Beautiful. And one more. Oh, that was so good. How did that feel?
Yeah, it felt really good.
Look at
Good.
Flamingo.
Thank you, June.
He's just sitting here. He's just sitting here.
He's just sitting there.
All right, Cindy, you can stop it for a second. Go ahead, please.
No. Okay. No.
So, with pregnancy, we can have round ligament pain. That's pain in the front of the pelvis here, okay? These ligaments do quite a lot of work when they're holding extra weight. So she does tend to have more pain on this left side, but we're gonna work on both sides here. The first thing I wanna do is to just stretch that out, and we can tell right away that there's some apprehension. Any further here and that would be pretty uncomfortable. How are you doing?
Good.
Good. You can feel that, can't we?
Yeah.
We're just gonna hold that for a couple more seconds. Then we're gonna stretch it in another way. We're gonna just let the body or the leg drop off. We're gonna stretch. How are we doing there?
Yeah, that feels really good.
Good. We got all kinds of action here. This is gonna be an amazing video, guys.
Action packed.
We got extra cast members here with flamingos and babies.
Sitting here.
Yes. Now we're just gonna put a little pressure therapy here, a little bit trigger point therapy right on that round ligament. Is that too hard for you?
No, it feels
Feeling
good.
He's
Yeah.
sitting on Sue's head.
It's sitting right on June's head. What does June think about that?
Sumi, Flamingo sitting right on Sue's head. Your head.
Okay. And we're gonna do that same thing on this side as well.
It popped on your head.
It'll be a little quieter.
How's that pressure?
Yeah, that feels good. It's a good stretch.
Good.
couple.
So through your pregnancy and then just as a wellness patient over the years, how has chiropractic benefited you? Does it allow you to do some things without as much flare-up, or if there are flare-ups, does it help you with those?
Yes, it helps me sleep way better. That's one thing I noticed if I haven't been here in a while.
Yeah.
I just don't sleep very well, but when I'm here consistently, my sleep is so much better, and I wake up, I have so much more like energy, and my body just overall feels good. Like I feel like I can do everything I want to do.
That's terrific, and I think it goes to one of those things that we may not talk enough about, and that's just a reset of your nervous system. So much of the thought with chiropractic is the mechanical side, like get something moving that's not moving, or put it in a position that's better or more efficient, these vertebrae or these bones in our pelvis. But every time we adjust your spine, we're affecting the nervous system, which is a phenomenal thought. So you did really well today. You did really well, and I appreciate you letting me videotape our experience today.
Yeah, no problem.
Thank you so much. Come on up and we'll kind of sign off from there. If you are pregnant or dealing with any discomfort in your spine due to pregnancy or anything, give us a call. Again, thank you, Emma, for letting me do this video, and girls as well.
Yes.
Take
oh,
care.
I actually was gonna say one more
Yeah.
thing about because I saw you guys when I was pregnant with both of them too, and something my midwives always said is that like the chiropractic care really helps with just aligning my body so that baby can be in a good position. And I had really smooth labors with both of them, and I think in due part to you guys and the help that you've given me. So
Fantastic. And I think so many people need to hear that, because pregnancy can be a pretty tough challenge. I mean, of course, I've never experienced it personally, but it is. It's a lot of changes. It's a lot of extra stress, and just a lot of things going on there. And we can do anything to help reduce that and have you have a better experience. That's what we want to do. So thank you guys. Have a wonderful day.